And with that, welcome to America's Heroes Group Roundtable with Clean Energy Infrastructure Partner Zodiac Solutions, LLC. Today is Saturday, September 3rd, 2022. September is National Suicide Prevention and Hispanic Heritage Month. You just heard our host, Cliff Kelly. I'm Sean Claiborne, the co-host and National Guard Army veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a great show today. We have two familiar faces, two familiar voices online with us right now. We have Rob Howard. He's a U.S. Navy veteran and president and CEO of Zodiac Solutions, LLC. And Rod Matthew. He's a U.S. Navy veteran, owner of Brevian Energy, specializing in microgrid technologies and renewable energy. And you guys are also joining us on Zoom, so we want to make sure that everybody's there and able to see you guys on either our YouTube channel or also on americashg.org. So now let's talk about how you guys will travel to local cities and states and also spread the word and implement clean energy infrastructure solutions. How are we doing this, boys?
Well, part of it is really, we really have to start with letting people know there is a huge amount of opportunity in two ways. People are talking about all these bills that were passed and the infrastructure bill. We're talking about the, the Inflation Reduction Act. But the reality is we're more focused on helping businesses recognize that as we get more renewables into the system, it also has an effect on the stability of our grids. Rod and I were just talking earlier. A lot of people, they need a crisis to make a change.
Yep.
And if you have a business and you got refrigeration, you got a business and you need things to be kept at a certain temperature, or you've got a factory process. Well, if you don't have sustainable power, reliable power, and the factory goes down, guess what? You got people sitting around, well, they want to get paid. And so what we're really trying to do is have people, let's start having a conversation about how to put yourself in the position with a microgrid. We're talking safe, we're talking renewables, but we're also talking reliability. So what we're trying to do is let people know, look, let's have the conversation, let's figure out what you need, because each one is going to be different. We're talking design builds, customized systems that are made just for your business. And if you want to help your bottom line, we'll show you how to help your bottom line through this process, because I don't know about anybody else, but utility bills are going one direction, and that's up. And so that's really what we're talking about doing, is being a resource to business owners to say, hey, look, I don't have to wait until I have a power outage to figure out I need safe, reliable, renewable power.
And then, Rod, tell us, for those of us, because a lot of people still don't know what microgrids are, tell us in a brief moment what microgrids are and how they work.
Well, first of all, thank you for having us. We appreciate the opportunity to speak with your audience is very knowledgeable. But anyway, a microgrid is effectively, like the word implies, is a smaller version of the electrical grid, right? So with the big electrical grid, you have a big power plant, mostly fueled by coal or natural gas, that turns a big turbine that puts out power that's distributed throughout the whole mass grid. In a microgrid, those generation sources are within your own building or community that's all connected together, and usually they involve PV solar, that's a generation asset. We use batteries or energy storage to store excess power when it's not being used. We use hydrogen fuel cells to produce that power. We even use wind turbines to produce that power. And the beauty of a microgrid is you have logic or a control mechanism that knows how to adequately or optimally dispatch those generation assets, right? So in the daytime when the sun is shining and the solar is putting out power, it knows, okay, put that power online. But as it gets towards the evening and your power is declining from that, it knows, okay, we can switch on to the battery because the batteries have been charging, so the batteries are good. Or like a backup asset like wind turbines, it can add that power when the wind is blowing. They know between a certain time, dispatch that particular asset. So that's really what a microgrid is. You're responsible for generating your own power and not relying on the larger grid.
And
but the fact that you are connected to the grid makes it a microgrid.
Okay. The cool thing about, and correct me if I'm wrong, about a microgrid is that you can create your own power system and not be reliant on the main grid.
Absolutely. That is really the intent. So you're not relying on the grid, because one of the big things people don't realize is when they're connected to the grid and they get energy from their investor-owned utility, there's a charge that they get charged. Not only do you get charged for the use of the power that you have, but you get charged for the power that's made available to you, right? Mm-hmm. So that's called a demand charge. So whatever that is, you're charged, and you get 15-minute intervals. You're monitored for your bill. And whatever highest 15-minute interval of power that you have for that month, that's what you get charged on a demand charge. So we can virtually eliminate that for you, because you very seldom have to pull from the grid with a microgrid. You generate your own power.
And can you sell that power back to the grid for a profit?
Yes, you can. In some cases, it can be for actual dollars. In some cases, it's for credits. It really depends on where you are.
Okay.
But yes, that's called net metering.
Okay. So Rob, tell me about your plan to travel around the country and start to bring this word out to people. What cities are on your agenda, and also how can people connect with you guys?
Well, I'm gonna have Rod give. We have an 877 number for people to call to set up time to work with us on getting the information we need. And what we're looking at is once we figured out, and we're working with customers, site visits are often a part of that. A lot of this work we can do literally from our office because of the technology. However, we're willing to travel to help people get this set up, because again, companies need to recognize we should not wait till you get a power outage before you decide to do it. So what we're just trying to do is make sure that we are customer focused on helping people get these microgrids the way they need to have in order to have safe, reliable power for their operation.
Yeah, we have partner organizations across the country that effectively extends our reach to really anywhere we can help deploy the system. So because of those affiliations that we have, we can technically design a system and deploy the system pretty much anywhere in the country.
What's that number they got to call?
You can contact us at 877-864-8777. Again, it's 877-864-8777. Or you can always shoot us an email to sales@Brevian. That's D as in Bravo, R as in Romeo, E as in Edward, V as in Victor, I as in India, A as in Apple, N as in November, energy.com. Again, that's sales@BrevianEnergy.com.
For our audience, be aware that this information will be made available on our YouTube channel and also on americashd.org. So you can also get this information and replay it, get all the data and the phone numbers again through our website and also through our YouTube channel. Now, I've noticed, I was at a workshop yesterday, I noticed that there was in one of the schools at South Suburban College was out there. Shout out to South Suburban College. They had a program that was teaching people about renewable energy and microgrids. Is that something that's being rolled out? Do you see more education going out there through the community colleges and around the colleges around the country and trade schools and things like that?
Absolutely. I think on the previous show that we had with you, as a matter of fact, we talked about you're seeing more of that education come online. And frankly, there's a lot of that stuff that's, free or, very inexpensive, to say the least. Enough information to get you familiar with what microgrids are, could get you started. And, if you choose that as a career path, they have a lot of courses that can really get you on your way with that charge little to no money. And we're really starting to see a lot of that starting to roll out at the community college level. Of course, they have some of those classes available in the major colleges. But our community colleges, where they support more of our technical training, you're starting to see those come out as course options to get like certificates in being a solar or renewable kind of technician.
And how hard is it, Rob, for you to create a microgrid for your business? Say you're a small business and you rely heavily on electricity. Maybe you're running a rig to try to mine Bitcoin or something like that, cryptocurrencies, which is a big thing, I know, in California. How difficult is it to create a system?
Well, it's really, if you don't know how to create a system, I would say it's difficult. But here's the thing. That's what we do. We take your information, we look at what your projected usage is, what your current usage is, what your projected usage is, the landscape that you have available. I'm talking everything from what's on your rooftop to land you have available. And what we do is customize it to maximize it. And another thing that I would say, we also talk to people about doing smart things like weatherization. You want to weatherize your facility so that if I'm running AC, I don't want to lose my AC out the window because I don't have good sealed windows and doors, so that now I use less power. So it's just about being smart. So I don't consider it hard. I think it's just a matter of understanding what resources are available, understanding what space is available, and understanding what technology is available in order to get you what you need, so that now you're, again, resilient, reliable, and the number one thing I think a lot of people care about, particularly when they're in business, how do I save on my electric bill?
And then how cost effective is it? I know there's a lot in the past, especially with solar and things like that. The startup cost and the implementation cost was so high that it really, for a lot of, especially homeowners and some small businesses, didn't make a lot of sense to try to invest in like a big solar panel or some kind of wind farm, mini wind farm, something like that on their roof or their building or their land. What are some of the incentives now being offered to help people get these things implemented?
Right now, you see with the recent legislation that just passed, there's 30% tax credits that can go directly towards the project. There are certain accounting techniques that you can use now to depreciate a project over the course of 5 years, a whole 100% of the project. So those are some of the incentives. And then I know earlier you asked the question about how hard was it to implement. I mean, it's as easy as signing a piece of paper.
Wow.
We can make that happen for you. So there's really not much you have to do. And the beauty of it is we work with finance partners where you don't have to come out of your pocket with a nickel up front. So no money up front, you just start experiencing the savings immediately.
And the thing I like the most about what you're talking about is the fact that you are energy independent. You're not reliant on a main power grid source. So if the power does go out, particularly as electricity becomes more in demand because we got electric cars coming online, we have all these new things, appliances, everything in the house is smart and electric. So we see electricity becoming once again, as it was 100 years ago, the foremost way of getting energy on planet Earth. I mean, so it makes sense. And we know that our infrastructure in this country has not really been maintained as well as it could have been over the last 50 years or so. So our infrastructure across the country is deteriorating. So this looks like something that, we really want to take advantage of. I think yet still, though, and I keep getting feedback from our people that are viewers and people that I talk to, that they just can't wrap their mind around it quite yet. They just don't understand, how easy or how the cost savings would be if they try to take a step and go in this direction. They think it's going to be something ugly in their house. It's going to be something that's going to take over their business. They don't really understand all the dynamics of what's going on. So, Rob, break down some of the things you would talk about when you meet people and travel around the country to try to get them more educated about the process and what they need to do.
Right, and I'll try to explain it this way, because I do understand. It's when you don't know. That's when it's like, because then you start creating all the unknowns in your head. But remember this, what we want to do is help you just think about what you pay in electric utility rates. We're going to help you save a third of it. Just now run the numbers on that. I pay $10,000 a month for the electric bill in my factory. I'm down to $7,000 a month. I now have $3,000 every month that I can pay for employee benefits, that I can upgrade other equipment. That's the first thing. The second thing is to remember this. We work with the available space. And I'm talking about it's not something where you're going to have this monstrosity sitting out there. The equipment, I mean, times are changing. And what we're trying to help, particularly in our community, is to help people get in front of this and not wait, because in those bills, there are limits of how much they're going to use for these credits and funding that's available. And let's not wait until everybody else got theirs and we are sitting here not getting what we need in order to help our businesses thrive and grow. So it's not that I don't look at it. And again, I understand I've spent 30 plus years in the utility industry. And what I am telling you is, if you want to not lose weeks of food and stuff in your, say for your restaurant, you don't want to wait till something happens. You want to get in front of it. So be proactive. And Rod can give you that number again. Just call us and we can set up some time to talk through it and see what we can do.
What's that number, Rod?
Again, that's 877-864-8777 or sales@brevianenergy.com.
So tell us also about, so when you go into different communities, first of all, when are you guys coming to Chicago?
I don't have a set date yet. I'm we're in September now, so it's this month. I'm traveling to Ghana to actually have an education conference to talk about just this. And so we need to set it up, and what we're going to do is based on the folks that call us, and we set up the appointments, and then we'll try to group some things and then head out there. I've got family in Chicago, so any excuse will do.
And then how small of a project is practical for a microgrid with today's technology? That's for either one of you guys.
You can really be any size, but for us, what qualifies is a project that's at least 100 kilowatts of peak demand.
And what does that mean?
That's what that means. What as we talked about, that 15-minute interval of how much power you would need ultimately to do what you do. So that's it. So that peak demand is whatever period. That's the summertime when, if you were a business that you're running all your AC units, you're running your refrigeration, you're running all your lights in the building, you got all your employees in the building at the same time. Whatever that demand is, you need the most amount of energy is. That's what we designed the system to meet.
So is that
going on to?
So is that a factory, or is that maybe could that be a storefront? Like how much energy would 100 kilowatts? How much would that?
100 kilowatts. It really depends on how much energy you're using, right? It could be a small store with, 15 AC units. It could be a warehouse that keeps the stuff cool. So it really depends on the power usage. But I would say somewhat like a small to medium sized office building.
Okay.
Would be about the size of 100 kilowatts.
And I can imagine, particularly with a business that size, that's how the cost savings would matter. It's particularly because I'm thinking of a business now that they spend about $6,000 a month in electric bills. Trying to keep a facility cool and when they have events and things like that in the summertime. That is huge. And so
right.
do you see the information trickling down to the ground level? This is my last question. Do you see that the everyday person now is starting to get awareness of this? Because a lot of people still have no idea about microgrids.
It's certainly an education process for us. That's something that Rob and I talked about. Even in our communities, we're not really aware of what's going on. So it's really an education process for us. But for us, what speaks volumes for us is the numbers, right? So we're able to assess what you're using right now, design a system, and come back and say, hey, listen, you're spending this. Now, with the microgrid, you can be spending this. They're like, oh, whatever, Mr. Microgrid, whatever you are, I like you. Because the numbers bear that out. So not only is it more responsible for the planet, not only are you getting more resilient power, but it is directly impacting your bottom line. And frankly, we work with a lot of groups like nonprofits, because really they can't take advantage of the tax credits anyway, and we have people who can fund these projects and take advantage of the tax credits, so it certainly is a win-win.
On that note, we have two great guys here going to give the information out about microgrids and technology, and also the importance of energy independence. Rob Howard, U.S. Navy veteran, President and CEO of Zodiac Solutions. Rod Matthews, U.S. Navy veteran, owner of Brevian Energy. Thank you, gentlemen, for joining us.
Thank you, sir.
Thank you.
Appreciate it.
This is America's Heroes Group. We'll be right back.
Hi, I'm Cliff Kelly, Vietnam veteran and host of America's Heroes Group, the game changer in radio, print, and digital media programming. We are a roundtable talk show where information, resources, and referrals are provided intentionally every Saturday to empower our military population on WVON 1690 AM, the iHeart Radio app from 4 to 6 p.m. Central Standard Time. Please visit our website at www.americashg.org.
What's going on? What's going on?
Hi, this is Cliff Kelly, the host of America's Heroes Group. If you or a loved one has been injured in an accident or the result of malpractice, you have only one chance to get the compensation you deserve. You need a law firm you can trust with experience and resources who will fight on your behalf. With a proven track record of excellence both in and out of the courtroom, call Seidman, Margulis, and Fairman at 312-781-1977 for a free consultation, or visit SeidmanLaw.net. That's Seidman, SEIDMAN, law.net.
Hello, this is Darren Jeffrey. I was the course creator for American Ninja Warrior on NBC. I'm also a founding board member for the Rick Harriman Foundation, or RHF. RHF is proud to partner with America's Heroes Group in bringing you this year's RHF Ninja Warrior O course, free for active and retired military families, September 10th and 17th at Rick's Place, located 5 minutes from the front gate of Fort Bragg, Fayetteville, North Carolina. If you're a ninja or wish to volunteer at this event, visit rhfnow.org/ninja and register. If you would like to thank these incredible men and women in uniform and their families, be a sponsor. Visit rhfnow.org/sponsor and come on out and meet the RHF family.
Market, advertise, and sponsor your business with Vietnam veteran Cliff Kelly and America's Heroes Group, where information and resources are intentionally disseminated via radio, print, and social media. Call our office for more details at 312-803-2618. The Talk of Chicago, 1690 WVON.
Welcome back to America's Heroes Group. This is our Community Outreach Roundtable. Today is Saturday, September 3rd, 2022. Our host is Cliff Kelly. I'm Sean Claiborne, Army National Guard veteran and co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a panelist on the line with us. She is Dr. Annaliese Cothron. She is the co-founder and executive director of the American Institute of Dental Public Health, AIDPH. And she wants to talk about the mission, purpose, and agenda of the American Institute of Dental Public Health. How are you doing today?
Hi, I'm doing well. Thanks so much for having me. I'm very excited to be here.
Our pleasure. So tell us, what is the main goal and mission of what you've accomplished to create this foundation? And also, what are the things that we need to know about dental health? Because I know that's something that's overlooked often and is not something that's commonly offered in the veterans healthcare system, and even things like Medicare. So what do we need to know?
Yeah, thanks for asking that question. I found that a lot of people don't understand that veterans aren't accessing dental care. Part of what we do here at AIDPH is focus on the science and research of dental public health. And so that's really where we focus our efforts in terms of supporting veterans to get access to dental care. And when we started this work, working specifically with veterans about 1.5 years ago, I asked myself those questions, right? So what do I know? What do we not know? And I found out that we didn't know a lot. And that's because most veterans don't have access to dental care through the VA. 85% of veterans are not eligible for dental care through the VA. And of the 15% who are eligible, only 1/3 actually utilize their benefit. So what that means is a lot of veterans are, one, not able to get care through the VA, and two, if they do get care through the VA, we know that they're not utilizing it because there are a lot of barriers to even getting into that care. And so our mission has really focused for the past year and a half on understanding what the barriers are to getting dental care, understanding the opportunities to improve access to dental care for veterans, and then figuring out how we can work with veteran service organizations to really help veterans advocate for themselves. That includes policy, that includes, for us, working with dental providers so that if you're seeing a veteran in the community in your private practice clinic, how you're able to provide them more culturally competent care. And so that's really where we've focused, both working with veterans and then, more importantly, working within just in the broader veteran community, looking at marginalized and historically excluded populations like rural veterans and LGBTQ veterans, and figuring out how we can kind of address their needs and also use our research to answer more questions and ask more questions.
So what are the barriers? Who is eligible to get dental care in the VA system today?
That is really complicated. And actually what our research has told us when we asked veterans last year, do you understand if you qualify for dental care through the VA? 42% of veterans said they didn't know. And that's because the eligibility criteria are very strict. They're set through congressional, Congress determines those guidelines in the federal code. And what it essentially winds up being is that veterans who are 100% disabled are the predominant group who has access to dental care through the VA, and then service-connected disabilities that, affect your mouth. So it's a very limited number of veterans who can access dental care through the VA. And unfortunately, what we found is a lot of veterans really don't understand, even if they do have access to that dental care, and what it could truly mean for them.
So what's the recourse? What do you do if you can't get dental care through the VA system? You can't get it really through Medicare. Where do you go? How do you pay for very expensive dental procedures when we all know that most of us are going to have issues, maybe needing dentures or things like that as we age?
That's absolutely correct, and that's the million-dollar question, because veterans aren't going to the dentist. When you're left with, like you just said, really expensive dental care, especially if you haven't gone to the dentist in a really long time because you don't have dental care, we know those issues just compound with each year. Each year that you put it off, we know that could lead to decay. It could lead to abscesses. We also know that as you continue to have issues and you continue to lack access to care, particularly prevention, that your care becomes more expensive and your needs become more acute. And unfortunately, our research indicates that most veterans are winding up in the emergency department for their care. So they're visiting an emergency room, and most of the time the care can't be contained there. They're just maybe receiving palliative care. They're receiving an opioid or something to help them with the pain. They may be receiving an antibiotic if they have an infection, but ultimately, most of the time, care can't even be treated in the emergency department. And our research actually indicated in the past year, it was through 2021 and 2020, because the survey was sent to more than 2,000 veterans last year. About $1.7 billion was spent in emergency department visits last year by veterans who said, I could not get into a regular dentist to meet my need, and I had pain or some sort of oral issue that I could only meet it at the emergency department.
Wow. So what do we do then? So if as a veteran, so do you have to get private insurance? Is that cost effective? Is it affordable?
I think veterans are stuck in the same position as many Americans, which is accessing a really fragmented system that you said could either be private practice, that's if you're employed or private insurance, and that's assuming that your employer pays it. It could be Medicaid, depending on your state eligibility. Some states have actually had carve-outs for veterans. Oregon just successfully passed a bill last year to provide more care in their state Medicaid system for veterans to get dental care. Or you're just simply left paying out of pocket, working with charitable care and foundations to provide access to veterans. But the options are limited. One option that I have found since working on this issue that a lot of veterans don't know. And it's really interesting because when I work with veteran service organizations and I mention the VA DIP insurance program, a lot of them say, oh, I've never even heard of that. So the VA does have what's the VA dental insurance program that's available to veterans as a private practice or private insurance option. The premiums are lower for veterans, which is great, and a lot of veterans do qualify. It's a really underutilized program. There are certainly some limitations in the type of care that can be covered through that, but it's an option for veterans to explore. I know through the course of my work with veterans, I've heard this a lot, where can I go, what can I do? And we like to promote the use of FQHCs, or federally qualified health centers. And those are health centers that are subsidized by the federal government, and they offer care at a sliding scale or completely free. Not every FQHC has a dental component, but a lot of them do. And so you can actually go to hrsa.gov and go to the Find a Health Center website, and you can look up one that's close to you. But I do want to say the caveat here is that it is limited. The options are limited. And unfortunately, we know that veterans are actually experiencing more issues than non-veterans because of connections to military service. We know that veterans actually have higher rates of chronic disease conditions like heart disease and diabetes, and that those disease conditions in particular are actually exacerbating oral health. We know that those have connections. So if you have poor oral health, you probably are poorly managing those diseases, and vice versa. We also calculated in our research that if we were just able to give veterans more effective care through the VA, which happens to be the largest integrated healthcare system, so that they can meet the medical and oral healthcare needs of veterans, we could be saving about $3.5 billion annually in diabetes management and $2.1 billion annually in heart disease management. And so if we're combining heart disease and diabetes and avoided emergency department visits, that winds up being about a $7.3 billion annual cost savings. That works out to be about 4.5 times the budget of the VA last year for dental services. So I think there's a lot of opportunities to expand eligibility. And while we're waiting on that to happen, there are some outlets for veterans to seek dental care. I know there's one locally in Chicago that we work with, the Aspen Group. They work with veterans and provide really comprehensive healthcare services. But unfortunately, veterans are left with this very disjointed system, trying to pay for care out of pocket, trying to find this infrastructure that often doesn't exist. And we think that that's inequitable. We think that veterans deserve equitable oral health care, and that's our job, and our mission is to do what we can to advance that.
Great. I think it was great you mentioned the Aspen Group, because I know every year they have a 1 day. I think it's on Veterans Day, I believe. Not Veterans Day. It can't be Veterans Day, but somewhere it might be Memorial Day, I think, where they do a day where they give free dental care to all the veterans across the country, which I think is remarkable and also something that's highly anticipated by a lot of veterans, because the waiting list fills up so quickly because people haven't had dental care in a long time, and that's one of the things that everyday people we forget about. We forget about taking care of our teeth. We brush our teeth every day, and then that's basically it. But I mean, as you mentioned, I was reading things by the Mayo Clinic. They said even in their reports and their research that there is a direct link between dental health and cardiovascular disease and other types of ailments that are seriously can affect your lifespan, can affect your life. Your livelihood and the quality of life that you have. And dental pain is no joke. So is the government now starting to reconsider and think about what they need to do to change some of the structure so they can start offering dental benefits?
I think so. I believe that's one of our big accomplishments this year, has been bringing awareness and visibility to this issue and pushing lawmakers to do something. I do know that there was a bill offered in this session that would expand the eligibility essentially from veterans who had 100% disability rating to veterans who had a 30% disability rating. It's essentially what it works out to based on the priority groups. The bill did not make it out of committee, but we as an advocacy group AIDPH, working with our veteran service organization partners like the VFW and Disabled American Veterans and the American Legion, we all really worked together to bring awareness to this topic. And I think we made it pretty far in just getting people activated and aware. In fact, we sent around a sign-on letter earlier this year. We had more than 70 organizations, both health and veteran organizations, support this bill from across the political spectrum, because it doesn't matter where you sit politically, we all have teeth and we all want them taken care of. And so what we notice is that this has broad bipartisan support, expanding dental care and getting veterans the health care that they need, a comprehensive health care benefit that includes their mouth and teeth, is something that a lot of people want to see. And as our research has demonstrated, it actually can result in a cost savings if you're able to give veterans consistent access to dental care that allows them to get the prevention that they need, and at the same time manages those chronic health conditions. We can actually save the government money. So I do think that was one accomplishment that we had this year, even though the bill did not make it out of committee. I think there's the opportunity now that we have some momentum, and I do think lawmakers are paying attention. I think we have the ability to really push them to do something in the next Congress.
I think it's really important that you mentioned that, the fact that we treat the problem once it becomes a problem, but we don't really think about prevention. We're not investing enough in the aspect of prevention. And maybe it's just a modern revelation of technology that dental health is preventative medicine to other ailments like cardiovascular disease and other things that, that affect people, affect the whole human body. So if we can get on top of this and do something that actually is a good thing to help people not have to experience unnecessary pain in their mouth and have to spend tons and tons of money on, the dental work that has to be done, we can do good and actually save money in the long run. So what do we need to do as a group, as a veteran community, to try to support your organization to try to get this move forward?
Yeah, I would say number one, if you want to stay involved, sign up for our listserv at AIDPH.org. Sign up for our listserv because we often send out calls to action. We view ourselves as the platform so that veterans and veteran service organizations can do the advocacy work. We provide the research, we provide the statistics, and we're there to kind of give the support and really kind of the technical pieces of things for veterans to then go and call their members of Congress, to call their local legislators too. There's a lot that can be done on the state level and say, my teeth matter, I matter, and there's all of this research that indicates I can save, that either my state or the federal government can save money by giving us this care. So I think it's really important to stay involved. We also partner, like I mentioned, with the VFW, with DAV. Those are great organizations to get involved with. I highly recommend staying, on their contact list. And then I just would say that for the most part, I think we're looking to kick activity up next year. We've put out a lot of research, and we're in the middle of putting out a lot more, again, focused on kind of veteran oral health broadly, but also taking deeper dives into discrepancies that we may see in rural areas. For instance, our recent research that was released in July through the Journal of the American College of Dentists indicated that rural veterans are more likely to have lost all of their teeth.
Wow. They're
far more likely to experience chronic health conditions as a result of living in a rural area and not being able to access care. So if you're able to advocate for yourself and we can give you the tools to do that, that's our goal. We're also disseminating another survey within the next month. And the way that we're able to put the information together and say, this matters, this is how we can save money, this is how you could potentially stay employed by having better oral health. We're able to do that because veterans participate in our research. Through our community-engaged research design, it means that when we partner with veteran service organizations, that we don't just use them to disseminate our surveys. It's a true, transparent, shared power, shared data process where veteran service organizations get exactly, they get all of the data, we give them, and we work together on insights. And so participating in our surveys and our data collection means that you're ultimately helping yourself, because we give the tools right back to the veteran community once we're able to analyze the data, so that you have the tools in your hand to go and tell your decision makers to fight for you.
So where do you hope to be this time next year with this issue, and also how do you plan to get to that next phase?
Well, the idealist in me says by next year we'll have an expanded dental benefit, right? That the VA will just give everybody the dental care that they need. That's where I'd love to be. I don't know where we'll actually wind up being, but I can tell you we're not going to stop. Our goal is to work with lawmakers to say our research indicates a cost savings. Not only that, our research shows that veterans can stay employed. They feel better about themselves. They feel like they can interact with their coworkers. They feel like they can ace a job interview if they can get access to dental care and feel good and confident about their smile and their oral health. And I think that that's resonating with lawmakers. And so that's where we hope to be next year, is with some sort of policy in place that gives more eligibility. I think it's sort of these two pieces. Number one, there has to be money in the budget to pay for it. And then number two, Congress has to expand the eligibility guidelines. And so I would hope that we can work on one or both of those two issues at the same time. And again, this is bipartisan. So I think reinforcing to all of our politicians and our lawmakers that this is not about any political party, this is about veterans, and that we have broad support on both sides, that hopefully as we advocate through the next year, we'll see some movement on either expanding the eligibility, so that it's more than just 100% disabled veterans who can access this care, or that we've been able to advocate through the appropriations process or some other budgetary process that money is there, so that when eligibility is expanded, we can support, veterans actually getting into the VA. The other piece that I would really love to explore more that I mentioned in the beginning is that 15% who are eligible and don't get care. I think there are a lot of reasons why that's probably happening, but we don't have those sort of quantified or substantiated. I'd love to know more about those veterans who can get care and aren't utilizing it for whatever reason. And hopefully through some sort of education process, we can increase that 1/3 who's utilizing that benefit. Hopefully we can pump that up to let veterans know you do have this care, this is how you can get to it, and why it's important to utilize.
Do you think that for that 15% perhaps that maybe they have other care that they have lined up through their job or through other sources, and maybe they don't necessarily, maybe they feel that care is, they favor that care versus going to the VA? That's
a great question. I think that's probably one. I can tell you my husband qualifies for dental care through the VA, and one thing that I've shared repeatedly whenever I talk about our personal story is, my husband's mentioned he's been diagnosed with PTSD, and he says going into a VA clinic and sometimes seeing other veterans and service members who may have been wounded in combat, it can be really triggering. And going into a VA clinic may not be the most pleasant experience, and coupled with going into a VA clinic and knowing you're going to be, having somebody's hands in your mouth, it can feel really invasive. So I think that's maybe one reason. I also think, too, that the VA is struggling with infrastructure, and we know that, right? We know that the VA doesn't have enough clinics, and we know they are certainly not located in rural areas where veterans are disproportionately located in rural areas. So there's probably just a geographic barrier to accessing care. I think what veterans may not know is that if you qualify for dental care and there isn't a VA dental clinic close to you, you qualify for community care, which means that the VA will pay for you to go into private practice care and, still cover all of those costs if there's not a VA clinic close to you. So that may be part of the education process for veterans, is just letting them know if you are covered, you can still utilize that benefit even if it's not at a VA clinic. So I think there's probably a few different things going on, and we don't have all the answers. It's probably a combination of different reasons why.
So on this is you may not have the information for this, or maybe can answer this question, but it's a tricky question in a sense. But do you feel, because we got away from this conversation and with other guests on the show and other panelists, do you see privatization creeping more into the healthcare system, and do you think that might be the way that dental care gets implemented into the VA system?
I I think privatizing the VA probably has some benefits, and it also has a lot of drawbacks. To me, I don't look at our research as advocating for one solution. I look at our research as advocating for a lot of opportunities. What our research indicates is that the bar is on the floor right now, that any advancement, any improvement, the opportunities are really endless right now because so few veterans actually qualify for VA dental care. So many veterans are experiencing really high out-of-pocket costs or not seeing a dentist at all. There's a lot of opportunities to just move the bar. I think what we try to reinforce is because of what our research indicates, which is chronic disease conditions and oral health care are so closely linked. The VA is the largest integrated healthcare system in the nation. That means that they all share medical records, that providers work together, often in co-located spaces. And the benefit of having a really high disease burden that can also impact your oral health and working in an integrated healthcare system is that that veteran can be treated holistically. So I would say that the VA as a healthcare system is actually really well positioned to meet the complicated oral health care and physical care needs of veterans and to do it all in one system.
I had a quick question about you mentioned about surveys. So when you do surveys, is it strictly through a VSO or through an organization, or do you offer surveys that people can log into, like a Survey Monkey type thing, where they can just log into your site and take surveys and give information so you can collect data?
Yeah, all of the above. So we're really thrilled that we've been able to create a network of partners who survey veterans for us, like the VFW. We also work with social media influencers, and they'll disseminate our surveys. And you can also go to our website when they're released on our Veteran Oral Health page and be able to take those surveys on your own. We also have an interactive data dashboard on our Veteran Oral Health page, and it gives you insights down to your state, cost, chronic disease conditions, all kinds of good information so that you can figure out what's going on with your state and what's happening in your community locally. So we try to give as much information that we can from these surveys, put it into interactive environments that people can go log onto our website and get more information about their community on their own. And that would include, too, if we have a survey disseminated where you're able to take that survey and give us feedback.
So the people listening to in our audience, make sure you go to the AIDPH website and also sign up for these surveys, give your data. They're not asking for personal data, correct? You're not getting personal information or anything like that. It's just basic information. Do you use a dentist and what types of services that you use? They don't know who you are. They don't have your name or address or any that kind of stuff, whatever, nothing personal. Go on the site, help them help us as veterans and make sure that we have dental care. So I appreciate your time that you spend with us. Any last words and anything you would like to impart with us before you leave?
Really, the only thing that I want to say is thank you. This is a cause that's very close to me. My husband is a Purple Heart recipient. I've been a military healthcare beneficiary my entire married life for 13 years. So I believe that veterans deserve equitable oral health, and that's one of our main focuses here at AIDPH, and we just really appreciate your service. We appreciate the time, and we hope to continue to work in this area.
We appreciate you, and thanks for all the things that you're doing. And once again, veterans, go to AIDPH and sign up, take a survey. And if you're a veterans organization and you have access to people and veterans, and I'm assuming you guys go out and also do workshops at VSOs and things like that, go make contact. Go reach out to the AIDPH. See if you can get them out to your VSO. See if you can get people to get this push forward. Because this time next year, hopefully, we'll be getting the bar off the floor. Hopefully, we'll have something to celebrate. So, thank you. This is Dr. Annaliese Cothron. She's a co-founder and executive director of the American Institute of Dental Public Health, AIDPH. Thanks again for your time.
Thank you.
This is America's Heroes Group. We'll be right back. We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, and service and food. Look good. Thank you for your service. Thank you for your service. Thank you for your service. Thank you, ma'am.
Okay.
On behalf of Cliff Kelly, America's Heroes Group, we sincerely thank Chase Bank for coming where it matters to help homeless veterans have a hot meal today and a care package. We are sincerely grateful for this partnership. Yeah. Yeah.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, and service and food. Look good. Thank you for your service. Thank you for your service.
Thank you for your service.
Thank you, ma'am.
Okay.
On behalf of Cliff Kelly, America's Heroes Group, we sincerely thank Chase Bank for coming where it matters to help homeless veterans have a hot meal today and a care package. We are sincerely grateful for this partnership. Yeah. Yeah.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, and service and food. Look good. Thank you for your service. Thank you for your service.
Thank you for your service.
Thank you, ma'am.
Okay.
On behalf of Cliff Kelly, America's Heroes Group, we sincerely thank Chase Bank for coming where it matters to help homeless veterans have a hot meal today and a care package. We are sincerely grateful for this partnership. Yeah. Yeah.
We have in our chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, and service and food. We have in our Chase bags, we have a care package of hygiene, we have shaving equipment, we have razors, and for the women we have the same personal hygiene items for them as well. And we want to say thank you for their service. This is Chase Bank. Thank you very much.
People in the neighborhood, free haircuts, and service and food. You look good.
Thank you for your service. Thank you for your service. Thank you for your service. Thank you,
Okay. On behalf of Cliff Kelly, America's Heroes Group, we sincerely thank Chase Bank for coming where it matters to help homeless veterans have a hot meal today and a care package. We are sincerely grateful for this partnership. Yes. Yes.
Resources and referrals are provided intentionally every Saturday to empower our military population on WVON 1690 AM, the iHeart Radio app from 4 to 6 p.m. Central Standard Time. Please visit our website at www.americashg.org.
Hello, this is Darren Jeffrey. I was the course creator for American Ninja Warrior on NBC. I'm also a founding board member for the Rick Harriman Foundation, or RHF. RHF is proud to partner with America's Heroes Group in bringing you this year's RHF Ninja Warrior O course, free for active and retired military families, September 10th and 17th at Rick's Place, located 5 minutes from the front gate of Fort Bragg, Fayetteville, North Carolina. If you're a ninja or wish to volunteer at this event, visit rhfnow.org/ninja and register. If you would like to thank these incredible men and women in uniform and their families, be a sponsor. Visit rhfnow.org/sponsor and come on out and meet the RHF family.
From the Xfinity Studios at WVON, it's America's Heroes Group, hosted by Cliff Kelly, with co-host Dr. Damon Arnold and National Guard veteran Sean Claiborne on the Talk of Chicago, 1690 WVON.
And welcome back to America's Heroes Group. We are globally connected, roundtable discussion on military family matters with our partner and family caregiver, Keisha L. Jackson, on the line, and she has brought us a great guest. September is National Suicide Prevention and Hispanic Heritage Month. Today is Saturday, September 3rd, 2022. Our host is Cliff Kelly. I'm Sean Claiborne, the co-host, Army National Guard veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. Keisha, how you doing today?
Hey, Sean, I'm doing well. How are you?
All right. You're a U.S. Air Force veteran and family caregiver, and you brought us today Miss Pamela Farrell, a caregiver, activist, pioneer, and owner of Cornrows and Company, and she wants to talk about hair care in the military. But before we do that, I wanted to give a little bit of information to our audience. She's the first African-American documented to help shape hair policies within the U.S. Armed Forces. And if anybody has been in the military, we know that, particularly once upon a time, especially when I was in the military, that you couldn't even cut your own hair without permission. So this is something that is very critical and important in the military circle. And also, She also played a pivotal role in assisting the Army and Navy with their review of hairstyle policies and regulations, and developed the Circle of Hair system, which defines different textures of hair. The system was used in the 2014 presentation to the Army and is now part of the Cornrows Incorporated collection and in the National Museum of African American History and Culture. Welcome to our show.
Thank you so much. Thank you for having me.
So,
hey, Sean, just before you get started, because I definitely want to give Ms. Farrell just a complete floor to just take her time, within our time. But there's two things that I definitely want to mention, because I was in the military during that time, and I can share my stories of my experience of how I was challenged with my hair and the length of my hair or the styles of my hair, and was asked, was it in red? At that time was in 3510, all of the different things that I had to go through. But the other reason why this topic is extremely important to me, because I started caring for my mother when I was in the military, but also caring for my mother after I left the military. And so I always emphasize the importance of self-care for caregivers. And one of the things that I can say of people of color, and I know I experience myself a lot of times when we're caring for people, we neglect to take care of our hair. And so my hair was in a state of shambles to the point where I had bald spots because I was so nervous from the different things that was going on. So to be able to have someone like Ms. Farrell to be able to come on, I am completely honored for her past, her present, and also her future, for what she's doing to lead the way for us in the military as well as for caregivers.
And I think that's really poignant. I remember when I was in the military, I cut my hair one time, and I was in, I think it was AIT, and they didn't like the way I cut my hair, and I just shaved it off to try to do exactly what they do in basic training, just make it all, low, basically. And because I showed up between two different formations with a different hairstyle, they wanted to write me up for destruction of military property. Because in the military, you're a GI, you're a government issue military property. So and it was no joke. This was actually a very serious thing. This is something that is I think. So with that being said, Ms. Farrell, how does hair translate to your identity?
Well, and it's interesting hearing your story, because I didn't know that. When I started out, the reason I started my business was because I lost my job when I was 18 years old because of my braided hairstyle. And I made a declaration that I was going to braid so many heads, this would never happen to anyone else again. And so that's how Cornrows and Company started. And we, years later, after we opened up, we put out a wanted sign saying that anyone that, experiences hair discrimination or that's threatened for losing their job because of their hair, call us, and we will pay your legal fees. We'll pay the attorney to represent you. And so we did get some calls, and it just really, it was in corporate America, and, private practice. So many people reached out to us because they were having problems with, at this time, it was wearing braided hairstyles. And one day I had a young lady come in who was in the military. She was in the Navy. And she asked if she could take my book and, to show them some of the hairstyles that were in there, to ask them whether they would change the grooming policies so that they could wear braids. And so, they reached out to me, and it was quite easy, actually, with the Navy. It took a couple of years. But the point that I made to them is, one, is our hair is different, and it has different needs. And particularly for someone in the Navy, it would be more practical for them to have a braided or natural hairstyle, if they were out and they were, on a ship for months, as opposed to, say, relaxing their hair, which was the other option. Relaxing your hair on a ship where you might not have enough water pressure. There's so many things that would be problematic. And so they got it. And they did eventually change the grooming policy to include braids. My experience with the military has been one of, we didn't have to fight that hard. And other, for example, with the Hyatt Regency Hotel, Marriott Hotel, American Airlines, these other places, it took years, and we had to fight. In 2014, I got a call from a young lady who was in the Army, and she was just in a total panic. And she called and said, they just came out with a new revised grooming policy, and we can't wear twists. And she had been wearing her hair in twists for years. It's easy, it's practical, it's neat, it looks, it's neat under the cap. And so, she had me get on the phone with several other young ladies that were also in the Army, and they were just talking about different strategies. So now this is a different time, because the first one, the Navy, was 1993. So this is 2014. So we have the internet, we have social media. So it was, as I listened to them and they took it to social media and just how they had planned to approach it, I thought to myself, I am not going to reinvent the wheel. I am going to, I pulled out some letters that I had written in 1993, and I just revised them. And in fact, my son, who was 15 at the time, he thought I was crazy. He said, "You are writing a letter to send to the Secretary of Army," and it was another one. I don't remember who I sent it to. And I said, "Yes." And he just chuckled and thought, no one is going to answer you. So anyway, I send these letters off. What I recognized was the people that are making decisions, they're not necessarily on social media. Mm-hmm. They don't use social media. And so that's why I sent the letters off. And I got a phone call 5 days later from the Pentagon, and they wanted to speak with me about the letter that I sent in regards to hair. And they asked, did I want to come to the Pentagon, or would I like for them to send someone to me? So I said, send someone to me.
You don't want to go to the Pentagon?
No.
I would have gone to the Pentagon, man.
I mean, cool. I just preferred to be in my own space.
Okay.
As I was talking about this issue. And it really turned out to be really good, because when the young lady came, I was working on a project, which is my Circle Here project. And they wanted me to come and do a presentation to 21 senior officials from around the country, a lesson on hair, because these were the people that would make decisions, I guess. And so I had 4 days to plan this. And I thought, why don't I use my Circle Hair to explain the difference with hair? I had decided that I was going to go in there and I was not going to talk about race, because this had nothing to do with race for me. Mm-hmm. This was simply about hair. Hair was the problem. And so I went in and I used Circle Hair system.
What is a Circle Hair system? Break that down a little bit for us that don't know. What does that entail, basically?
Okay. So if we look at our hair, strands of hair, they're circles, and they come in different sizes. And so what I discovered for myself is that there is circle hair, and there is what I call line hair, straight hair. There are more people in the world with circle hair. Mm. But what was happening, what I found, was that they created a policy for line hair. And that was really, when I went in, I was able to show them. I was able to show them the distinct characteristics of these two shapes of hair, and, what happens when they get wet. One stands up, circle hair will stand up, it expands, and line hair will hang down. The difference in terms of if we do a wash and wear hairstyle with circle hair versus someone that does with line hair. And so because it was a conversation totally about hair, and I even put together these boards where I actually, stapled hair onto these boards. I used to hate these, they used to do them in school where the kids had to do the little presentation on these boards. And so that's what I use. In fact, those boards now are in the African American Museum collection, Cornrows and Company collection. And so, I mean, they totally got it because it was about hair. And they changed that policy. You know, I got a call probably, I would say like a month later, telling me that the policy had been changed. And they said a policy had never been changed that quickly.
What made you think they changed it so fast? Why do you think they did that?
Because they understood it. They understood it because it was about hair and not race. It's hard to win arguments about race. No one will ever admit that they're a racist. You know, even a racist doesn't think they're a racist. You know, they don't think that they make decisions based on race, but they do. And so I always know that that is a harder argument to make and to win. And again, the problem is hair. So if the problem's hair, let's talk about hair. And they totally got it. And it was interesting because there were more men in the room than there were women. And so, you know, men don't know all the nuances of hair that a woman, you know, has to go through. They, you know, they don't know that a woman with circle hair could straighten their hair and then go out and get caught in the rain and it's going to transform and do something else. They don't know that. And so, you know, so for me, it was just an opportunity to educate them on hair so that when they have to make a, I guess, management decision on, you know, based on someone's hair, they can do it and be more informed about it. So they got it. I think that's why they changed the policy. And I did get to go to the Pentagon. They honored me at the Pentagon.
All right. So what did you think about the Pentagon?
I got a special tour. I had never been to the Pentagon,
wow.
You know, and I got a really special tour there. So
I think that's really important what you've done, because we can spend more time on being sailors, Marines, Army soldiers, airmen, you know, guardsmen, things like that, as opposed to worrying about your hair.
That's right.
Spending an hour every day trying to figure out how you're going to what you're going to do with your hair. But go out into the field, and what you're going to do about your hair.
Yeah, Sean, and like you say that, I remember. I was saying, I remember that specific thing. Every day I would come into work, and I would ask some of my friends, "Hey, look at my hair. Make sure it's this. Make sure this, you know, pin up." And it was an added responsibility that you had to do even before you can do your work. So that's exactly right. That's what I had to do as well.
Yeah, you know, and I mean, you all serve the country. You work hard. Why should you have to go in? You know, and I think it creates this insecurity. You know, feeling like, is my hair right? And that was the other thing I said to him. I said, you already have a policy in place. If your policy says that the hair has to be above the shoulder, then it shouldn't matter what the texture of the hair is. It shouldn't matter if it's braided. If your policy says that your bun shouldn't be extend out more than, I think it's 2 or 3 inches. If someone has a braided style, that's a bun, or if they have locks and it's neatly groomed and pulled back and it meets that standard, you know, why are you singling out, you know, certain ways that people wear their hair? And so, you know, so, I mean, they have policies in place. And, you know, as with everything, there is this idea that people in management positions, doesn't matter whether it's military or in corporate America, that they control our hair in particular. Because, you know, they don't have policies that say you can't wear straight hair.
Right.
They don't have policies that say you can't have blonde hair. I mean, you know, even if you're born with naturally blonde hair, I mean, that would be like crazy to say that, right? To create a policy.
If you don't have that experience, they would never know.
Right.
And then one of the things, like a lot of guys, particularly African American men, but not just African American men, but guys that suffer from razor bumps. So in the military, when I joined the military, you had to be clean shaven. That was a big deal. And then a lot of members seeing the struggle with a lot of young men who were first time shavers who had these horrific razor bump outbreaks, sometimes having to go to the hospital, having to go to the clinic to try to get these treatments for their skin because they had these huge blisters and bumps that looked like they were afflicted with some kind of disease, when there was really just razor bumps because they were shaving too close, but the military required that you have close shaven skin, so you had to have a baby smooth face in order to report to formation. So so has anything been done on that? I've noticed in a lot of the elite units, like the Navy SEALs and things like that, I know those guys are going around rocking these long bushy beards and things like that. Is that still something that is that soldiers have to do?
That I don't know. From what I understand, they've changed the policy, to take that in consideration, and men can wear beards. I don't know what the policy is in terms of how long it can be, whether they have to keep it well groomed and cut short, as opposed to being shaved very close. I don't have a problem with standards, but it should be a standard that everybody can meet. And it should be a standard that takes in consideration that, we're not this monolithic people. And when you talk about razor bumps, again, we're talking about circle hair, because that hair grows out in a circle, and in some cases, when you cut it incorrectly, it becomes an ingrown hair, and that's what creates that inflammation.
And then when you have people in the military, they can't really teach you that. And I remember seeing young. I was blessed because I didn't really have a beard when I was in the military. I was too young to really grow it. I had a baby face to begin with. So when I was in the military, I could just rip out a big razor and I could shave once a week, and that was good. But for guys that had bushy beards, it was just, oh my God, it was just horrific. And some guys even had to miss training and get pulled back and redo training because they missed so many days because their skin was inflamed and things like that. So.
And it's not like they teach you how to shave.
Right, exactly.
You understand what I'm saying? It's just shave it by any means necessary. So can you imagine 18-year-olds not really knowing, what kind of razors to use and products and things like that? So
tell me, but going back to my original question, Ms. Farrell, go back to my original question. So particularly for a female, for a woman, how does hair translate into your identity, like who you are, and then what does it mean to a woman? Because I know I've never seen a lot of these movies, but I know these movies are out there where there's all kinds of different coming of age movies where women, particularly black women, are cut off all their hair because they want to make a statement, or they get fed up with all the stereotypes and images that they have to adhere to try to become this image of beauty, and they do something to rebel against that and they make that symbol their hair. So how does hair translate to your identity?
Hair is really important. It's the first thing that you will notice on a person. When your hair is done, I know for me and for many, you feel good. So now we're talking a mental health issue here, Well,
you got 30 seconds, so we got to finish up quick.
Yeah, so hair is really important in terms of identity because it says who you are, and we all don't have the same hair, and so hair requires different ways of grooming it and styling it. And when you create one standard, and everyone is trying to meet that expectation, that's where I think it's a hardship for women and people in general as far as their identity.
Keisha L. Jackson, U.S. Air Force veteran and family caregiver, and she brought us a great panel with a great topic and a historical person at that. That is Pamela Farrell. She's a caregiver, activist, and pioneer, and the owner of Cornrows and Company. And thanks for joining us. We appreciate your time, and God bless you guys.
Thank you so much for having me.
This is America's Heroes Group. We'll be right back.
I'm Cliff Kelly, Vietnam veteran and host of America's Heroes Group, the game changer in radio, print, and digital media programming. We are a roundtable talk show where information, resources, and referrals are provided intentionally every Saturday to empower our military population on WVON 1690 AM, the iHeart Radio app from 4 to 6 p.m. Central Standard Time. Please visit our website at www.americashg.org.
What's going on? What's going on?
Hi, this is Cliff Kelly, the host of America's Heroes Group. If you or a loved one has been injured in an accident or the result of malpractice, you have only one chance to get the compensation you deserve. You need a law firm you can trust with experience and resources who will fight on your behalf. With a proven track record of excellence both in and out of the courtroom, call Seidman, Margulis, and Fairman at 312-781-1977 for a free consultation, or visit SeidmanLaw.net. That's Seidman, S-E-I-D-M-A-N, law.net.
Hello, this is Darren Jeffrey. I was the course creator for American Ninja Warrior on NBC. I'm also a founding board member for the Rick Harriman Foundation, or RHF. RHF is proud to partner with America's Heroes Group in bringing you this year's RHF Ninja Warrior O course, free for active and retired military families, September 10th and 17th at Rick's Place, located 5 minutes from the front gate of Fort Bragg, Fayetteville, North Carolina. If you're a ninja or wish to volunteer at this event, visit rhfnow.org/ninja and register. If you would like to thank these incredible men and women in uniform and their families, be a sponsor. Visit rhfnow.org/sponsor and come on out and meet the RHF family.
Market, advertise, and sponsor your business with Vietnam veteran Cliff Kelly and America's Heroes Group, where information and resources are intentionally disseminated via radio, print, and social media. Call our office for more details at 312-803-2618.
Welcome back to America's Heroes Group, this time with our roundtable Mental Health Matters with our partner NAMI, that is the National Alliance on Mental Illness, and this is NAMI Contra Costa in California. Today is Saturday, September 3rd, 2022. September is National Suicide Prevention and Hispanic Heritage Month. Our host is Cliff Kelly. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our panelist on the line with us is Phil Arnold. He was a voice intercept processing specialist with the United States Air Force Security Service, and as some of us know, they work with the National Security Agency, the NSA. He also, and correct me if I'm wrong, Phil, you're a veteran serving in Europe and the Middle East as a Russian interpreter. Is that correct?
That is correct, yes.
Okay. So we're going to talk about NAMI Contra Costa and what they're doing on the home front for vets, and the program called the Home Front for Vets out in California. What you guys are doing out there is amazing. So tell us more about it, and also, what do we need to know?
Well, the program itself is designed by NAMI National, and what it is, it's a multi-part program that helps families understand that life interrupted is something that they can't get their arms around, because it's the person that left them to go into the military and serve into the military was basically became government property. And that may sound harsh, but it's, when you say life interrupted, that means that these individuals, whether they were drafted back when I was or volunteered in, they had to learn how to do things all over again. And the first thing was, which was a humbling experience, is we're going to teach you how to walk. Well, I've been walking for 18 years. What do you mean you're going to teach me how to walk? We're going to teach you how to walk the government way, the Army way. Left, right, left, right. And I always take an informal poll now when I see people across the street, okay, when they wait for the light to change, what man starts with his left foot? Somebody starts with their right foot to take their first step. probably hasn't served in the military, but that left foot, that left right is ingrained. Little things like you've got to go into the chow hall and you've got to learn how to eat in 10 minutes from the time you go in to the time you leave. It's like, well, no, it takes me about 20 minutes at home. You're not at home. And when your drill instructor gets you and says, I'm your mama, I'm your daddy, I'm your brother, I'm your sister, I'm all those things combined, and you can't go home when you want to. And then there's things that are indelible that we understand that say when that person comes back home, they're not the same person that left. And that's the challenge, because there's a huge delta. How do we build a bridge? And we build a bridge by listening. I talked to a 77-year-old female veteran the other day who served 20 years and then felt compelled to go into the prison system and serve those veterans who are reluctant to identify because of embarrassment.
Wow.
And help them with the transition, re-entry. You have re-entry for those that are incarcerated, but re-entry for those coming back from Middle East, from Asia. There is no book for it because each one is different. Mama wants to hug you when you get home. My baby boy is home. Like, Mama, I ain't your baby boy.
Mm-hmm.
I'm your baby boy, but I'm not your baby boy. I'm different now.
Yeah.
I smoke, I drink, and
so how does a person, when they have these ghosts of the military, and what you touched on something that I think every veteran can identify with, and I mean, even if you just go, no matter what your service was. I remember when I came back from AIT, it's like you're fish out of water. It's like, and everybody has that weird moment where that weird thing when you wake up and there's no reverie when you wake up at 4:30 in the morning. You wake up and then you're somewhere else. You're not in a barracks. You're not in the field. You're just out. You're in a room somewhere in the civilian world, and now you got to try to remember how to do stuff. And your first instinct is to put on your PT uniform and go running or something like that, or do exercise, but you don't have to. How do we? I mean, some people say, well, time heals all wounds, and eventually kind of those things fade. But like you said, there's some of that residue that doesn't go away. What kind of things can you offer us to try to help us adapt?
Well, the first thing is to understand you are not alone. You are not alone, and there's nothing wrong with you. And when people talk about PTSD, I had PTSD basically from birth as an African-American male because I was born suspicious. I might as well have been born with a couple of handcuffs on saying, okay, here's where you're going to end up. And I'll just give you a couple of punctuation points for me. I was born in 1946, and 23 short days after I was born in October of 1946, Disney released a movie called Song of the South. And that Song of the South was Uncle Remus, Brer Rabbit, Tar Baby, and everybody saying the plantation life was idyllic and it was wonderful. Everything is satisfactual. And it's like, okay. And then when I got to the Middle East, I was treated better by the people in Turkey than I was in my own home.
Wow.
I'm like, because I look more like them. And they readily identified with me. When I was 8 years old, the Brown versus Board of Education decision was passed. So I went from the comfort of my then called colored school, where the teachers knew my parents and my grandparents, and that was traumatic when my mother said, "Little Phil, you've got to go to the white school next year." In white school, greeting me with fists, spit, punches, slurs. And for the year and a half, I prayed, Lord, if you exist, let me wake up white tomorrow so this nightmare will be over. And then by the time I was in the 9th grade, I was 6'2" and about 210 pounds, and I found out that I could hit white boys and get no rid of this rage and anger on the football field. And they would cheer me on. So I had an outlet for my rage and anger. But that was trauma. When I was 9 years old, Emmett Till was murdered. And they were telling me, Phil, don't do anything at the new white school to get yourself lynched like Emmett Till. What 9-year-old wants to hear that? Don't punch the white boys back. What? Don't talk to the white girl. Okay, trauma. When I was 9 years old, Rosa Parks, and I could see her on TV at night. 12 years old, Ruby Bridges being escorted into school. Is that PTSD? For me, it's post-traumatic segregation disorder. Because now I'm required to assimilate and play by some rules that, like I said, military is very similar. You have experiences. There's a picture of a young girl walking down the road with GIs behind her from the Vietnam era. She's got her arms out. She's completely naked because she had to take off the clothes that she had on because they were on fire. Can you say that I'm a tunnel rat and I go down with a 45 and a flashlight on those tunnels in Vietnam without coming back and saying anything that pops or cracks is going to make me jump? Okay. Drinks for 25 cents when I came out in 1969. Who wouldn't drink?
Wow.
Who wouldn't drink? In Turkey, Turkish kids came through the barracks. Grocery bag full of weed. Weed. GI, you want to buy some weed? I'm like, no, how much? 25 cents. How much should I get for 25 cents? Oh, the whole bag.
Wow.
So it's going to help me get through this tour of duty?
That Vietnam is the most revolutionary war and to me the most traumatic war of all the wars that we've ever, in my opinion, that we've ever faced. My humble historical opinion. I mean, granted, not to take anything away from any other war, and I know you guys also had a lot of caught a lot of flack because when you came back, the reactions and a lot of the feelings that people from the Vietnam era were facing as young men and women, the World War II generation didn't understand. They couldn't relate to it. I mean, they looked down on you guys a lot of times. You know, they took that war to really, because a lot of the experiences and the horrors that those guys faced, they didn't talk about. And then another thing I want to tie in a connection to, which is a good and a blessing and a curse, is that the embrace of technology, particularly in healthcare, because a lot of soldiers that wouldn't have made it back home in World War II were making it back home in Vietnam. A lot of the soldiers that made it back home in Afghanistan and Iraq would have never made it back home in Afghanistan because those injuries that they suffered on those battlefields were death sentences most of the time. Now, guys are coming back with a quadriplegic. They're coming back with no eyes, no arms, no legs, and they're still alive. They can actually have artificial limbs and things. That technology has prolonged the life, but those memories are still there, and those experiences are still there.
Oh, absolutely, and that's what haunts me on Veterans Day. So, okay, veterans eat free. It's like, okay, so are you going to pay for the Uber from the VA hospital where that brother has been sitting there now for 9 years with no legs and no arm? You're going to pay for Uber to take him down to your restaurant and get him a free meal? Or are you going to have it delivered? Oh, no, we're not going to deliver it. Okay, so as I indicate, don't let your mouth out and check your body can't catch. Simple as that. Okay, yeah, we love veterans. I said, what are you doing? My mother told me a mantra to live by. She said, when this thing happens with Brown versus Boardification, it's going to be the best thing ever happened to you because you're going to end up being forced to be bicultural. You will be comfortable in the black community, but your friends in the black community may not always be able to walk over with you to the white community. You'll be comfortable in the white community, in the boardroom of America, but those friends may not be able to walk over with you to, so you'll have a foot in each camp. And that's in the book. In the book Spook Who Sat by the Door, it talks about a black man in America with a pair of green work pants and a green shirt and 3 light bulbs in his hand can walk into any boardroom in America so long as he's looking up at the ceiling. And they'll continue talking, thinking he's nobody. It's like, you're nobody. You're just the janitor, just the custodian. So I learned to capitalize on that. I'm nobody. I'm just an old brother with a gray beard, harmless, probably unemployed, probably done some time and been formerly incarcerated.
So what's the first step for veterans when they come back and they're trying to integrate back into society? What's the first realization that they should know? If someone were coming back, say off a ship today, and come back from Afghanistan or any tour, and they sat and they sat down with you, and you want to give them one piece of advice, what would that be?
That come to terms with the fact that the person that you left as is completely different from the person that you came back. Your family cannot experience your experiences. They can experience you, and they're going to ask you the same old question. What's wrong? What's wrong? What's wrong? And somebody asks you enough times, what's wrong? You're going to say, well, there must be something wrong because everybody's asking me what's wrong. And sometimes in partner language, you just say, I so feel like doing that shit. Excuse me, my language, that's how we talked. That's how we talked when we were in the foxhole. We didn't mince words because it could be our last word. You know, we wrote a blank check. And what do we get for it in return? Camp Lejeune. Okay, wow, I get more Camp Lejeune ads going into our email now. Like, if you serve from 53 to 87. Wow, okay. All right, my father-in-law, you see, and the drop that I have back here, Tuskegee Airman.
And was your father a Tuskegee Airman?
My father-in-law, not my father. My father was regular Army.
Okay.
He was a first lieutenant, a duck commander. That's the amphibious vehicles.
Okay, yeah.
But the bomber group for the Tuskegee Airmen never saw action because the morality of our country at the time was that you just can't see colored boys dropping bombs on white people in Europe. The Red Tails can defend the white bombers, okay, and sacrifice their lives so that their bombers flown by white boys won't get shot down. So it's all these things that come to term, particularly for African American veterans. That's why we have at NAMI, the African American Uplift Program, to reach out to our kids to say, you're going to have polytraumas your entire life. It's embedded into our system. It's embedded into who we are. There's a hierarchy. There's a status quo. You know, you're this, you're that. You're defined by your stuff. Nope. My wife and I would talk. She said, what are you going to talk about? I'm going to talk about little things like when somebody says, got your six. If you've been in the military, you know what that means.
Got your back.
If you haven't, what do you mean got my six? Got my six what? You got six in my what? No.
No, you got 5 on it? No, not talking about that.
Right, so you learn a new language, you learn how to walk, you learn how to talk, you learn how to dress. What do you mean dress? You learn how to dress. And you understand what it's like to have a foot locker turned over when the barrack comes in for inspection, and they measure, and they get a tape measure out and measure the distance between the toothpaste and your shaving cream. And they look at your razor and say, your razor's dirty. And then they flip it over. Do it right. And everybody else goes, And then you discover what a sock party is. A sock party? Yeah, it's a sock party. Y'all got different kinds of socks that we can wear. No. That's that bar of soap that goes in the sock, and they hold you down with your blanket, and everybody comes by and takes a whack at you.
I never knew people. I've never seen that happen in my experience, but I've heard that was a common thing prior to my generation. I went into the military right after Desert Storm because I graduated high school in '92. So, and I was in from '92 to about 2001 actually, right before 9/11. But so do you think, and this is the thing, I remember hearing stories from our first sergeant. I was in Fort Jackson, South Carolina, and he was telling me the things he had to do through his basic training, and I was in AIT at that time, but he was telling us this, like all this, the crazy, like it was just these, but I mean things, it was like a marathon man type, like obstacle course and this crazy stuff. Like you were literally were training you for like war for real. But then fast forward to the Middle Eastern wars of today, and I couldn't even imagine the type of grueling preparation, being out in on your own in the wilderness as in basic training. Not talking about advanced training, not talking about advanced infantry or anything like that. Just basic training, having to be out in the woods and fend for yourself to get out of basic training. For 3 or 4 days or whatever, and having to navigate a training course that's like 15 miles long on your own, and having a deadline. You know what I'm saying? At the other end of it. I mean, that's like what? And we're complaining about this. We're complaining about a 15-mile road march, and like these guys got to do a whole 15-mile obstacle course, and like life lessons learned, and life strategies all about themselves. So do you think that we're getting softer as you see now? I don't see guys having to polish their boots anymore.
That's an interesting question. I don't say softer, I say distracted. I would say we're distracted by so much that is in the social media. And I'll go back to my training, because when I went into basic training, they always submit you to a battery of tests, intelligence tests, aptitude for mechanical, administrative, and a couple of others. And I scored high on it. And they said, we're going to send you to DLI. And I said, okay, what the heck is DLI? That's the Defense Language Institute run by the National Security Agency. And meanwhile, we're going to do a clearance background check on you while you're in the school. And we'll cover 6.5 years of college Russian in 9 months. And you will come out and have a working vocabulary of about a 6th grade student, but a technical vocabulary exhaustive enough to fly any Soviet aircraft, the MiG-19, 17, 21, and the 23, which one shot down the Mandrake, by voice command, and also including the Soyuz space modules. So you can listen to them from the Tbilisi control down the Kapustin Peninsula and see how accurate they were with their missiles. So I'm looking, okay, whoa. And when I got home from language school, my father, first thing he said, whatever you did, admit it and get it over with. What do you mean admit it and get it over with? There's people crawling all over the neighborhood asking all kinds of questions about you. I said, oh, they're doing my background check. He said, no, not background check, they just, that's 2 or 3 references. Not the government way. Government way, they dig deep and want to find out if there's any connection, anything you've done that would prevent you from having a clearance that, if you intercepted a message, could be on the president's desk in 37 seconds from anywhere in the world.
How much pressure is that to do you think about the pressure, or is there any pressure on you when you're going through this? Because some people say, oh, like I've heard of guys that are in silos, nuclear silos, for example, and it becomes routine because there's not like there's a war every day. We're not launching nukes every day, so it gets into a routine, like a fireman waiting in a fire station for a fire. Sometimes, is there pressure when you're going through that?
Yes, you're pressured for accuracy. So I'm sitting there, and I got these tapes running, recording it, and at the same time I'm taking Russian shorthand, jotting down for my analyst to take a look at and say what's going on. But after I got to Turkey, the city that I was in, a place called Trabzon, Turkey, 25 kilometers from the Soviet border on the Black Sea, at a listening post. We're on top of a mountain, about 1,000-foot mountain. And it was interesting to me because after I was there for about 3 weeks, we intercepted a message from the Russians, and they said, hey, Phil, you've arrived. I said, what do you mean I've arrived? Well, you've arrived. Everybody gets one of these. I said, what is it? And it said, Dear Sergeant Arnold. This is the Russian message we intercepted. Dear Sergeant Arnold, welcome to Trabzon Air Station. We hope you enjoy your tour of duty. We know that your parents, Phil and Juanita, are very proud of you back in Cincinnati.
This is from the Russians?
We intercepted it from the Russians, yeah. I'm like, well, I can't say what I said.
Right.
But I'm like,
wow.
They know I'm here. They know I'm here.
Wow.
Well, they listen to us just like we listen to them. They know every move we're making. We know every move they're making.
Wow. So do you think the world's a safer place because of these types of operations?
I think it is because nothing escapes now. The Vietnam era was measured in body bag count. You can watch the TV and say, here's the body bag count for this week. Okay, so we're going to send so many body bags, we're losing so many. Okay. And that was just a flashpoint on TV. Flashpoint. The war wages on. We were there, in 1955? 1955.
So what are wars measured in today compared to what they were measured in the past? And to me, there seems like in technicality it's like it's ongoing now. It seems like this is just an extrapolation of the Cold War. I mean, what we're dealing with Putin and what's going on in Ukraine and what's going on in the Middle East, and with different allies, and trying to figure out who's our allies and who our enemies are. But then this thing called global commerce seems to be the thing that keeps us all in check. Nobody wants to disrupt the paycheck, that's flowing around the world. So China is kind of, friends with us, but they're not friends with us. And then Russia's, they're an enemy, but yeah, we do business with them. So what's the metric today?
That I don't know. And my primary occupation right now is grandfather. Okay, and I want to be the go-to person for them to understand. The Lord gave you 2 ears and 1 mouth, and you should use them proportionally. Do more listening than you do talking. Okay? And I said, I will take you to Proverbs 18:6, which says, a fool's mouth is his folly and deserves a beating. God didn't say punch him or give him the right hand of fellowship. God said he understands how you're feeling. Okay? And I've given a couple of people right hand of fellowship over time, and that just comes with the territory of being in the military.
Would you want your grandkids to grow up and join the military? Would you recommend that?
I advocate bringing back the draft. Yes.
Okay. Why is that? Why the draft?
Because of kids to get away from home to see how truly blessed we are. You've been out of the country. Things that are craved for, like a stupid popsicle. This country doesn't have popsicles? No, it doesn't. And the little things that you realize you had advantage for. I want a White Castle hamburger. Because that'll cut my whiskey at about 2 o'clock in the morning. Okay. But I think that if kids can get out from under their neighborhood and see how blessed we are, and do some self-introspection to say, it's going to be hard, it's going to be rough. So what? How many ways have I been discouraged? How many ways have I come across the different things? I'm going to my junior year in high school, and 16th Street Baptist Church is bombed. Wow. And 4 little girls were killed. Daddy, can they do that? Yes, and they will, son. I'm like, wow. Medgar Evers was shot and murdered in his own driveway at home.
Wow. On that note, Mr. Phil Arnold, that was a great conversation. We're running out of time, so we got to wrap it up because we got Labor Day to celebrate, and also we got things we want to discuss with our audience. I really appreciate your time. Phil Arnold is a voice interpreter processing specialist at the United States Air Force Security Service who works with the NSA and also is works with NAMI Contra Costa in California, the National Alliance of Mental Illness. And he talked about, and we're going to talk about a later time again in more detail, home fronts for vets to try to get information and make sure these vets come home safe and also with good guidance and also good counsel. Thank you for your time, sir.
You're more than welcome. Thank you for the opportunity. Appreciate it.
My pleasure. So we want to give thanks to all the people that are listening today and also our global audience that are out there, making sure that you know that we are America's Heroes Group. AmericasHG.org is our website. You can always reach out to us, and I even need that information. So you want to reach out to us, you can send us by a mail or a letter at 155 North Wacker Drive, Suite 4250, Chicago, Illinois, 60606. You can also reach us by phone at 312-803-2618. And then once again, don't be afraid to reach out and give us information on our website, americashg.org, and also see us on our YouTube channel. We have our YouTube channel, search America's Heroes Group, where we can see some of the old shows, the archive shows, and also leave comments and let us know what you're thinking and also what we can do better. And also, we like to give thanks to our digital media producer, Ivan Ortega, for doing a great job, our executive producer, Glenda Smith, who was at home taking care of her mom today. And we also have Justin, our today's stand-in producer. He is doing a great job, and he has helped us out today. Give a hurrah to Justin, and a big hurrah to Jaden, our technical producer, Lady J, always keeping it on steady. This is America's Heroes Group. Happy Labor Day. Stay safe. Don't let off any loud noises. Think about your veterans that are out there that suffer from PTSD and also don't like to hear things that resemble gunshots. See you next week.